how can we instantaneously diagnose that he or she has a heart attack? In short, what are the signs and symptoms you see? And what is the most sensitive test by which we can make out, yeah, here is a patient who has a heart attack?
We are seeing younger and younger heart attacks these days. The age of heart attack, mean age of heart attack in this country is 10 years lower than the West. We're seeing heart attacks in women rise by 100%, double in the last 15 years. And we've seen it rise by 3 times in age group of less than 40 years in the last 15 years. So we actually have to be wary of the fact that it's no more a disease of the old and ye to zindagi mein baad mein hota hai. It's actually affecting the younger age group of less than 40. That's why your question becomes so important. There's a second point that I want to add. It's better to avoid having heart attack by preventive measures, because death from heart attack has, deaths from heart disease have, while in the West have decreased by 50%, India in the last 30 years is only increasing its deaths from heart disease. So let us now come to how do we recognize a heart attack? A heart attack is when there are 3 arteries which supply the heart. Heart is a muscular pump. It continues to beat and push blood, get the blood from the lungs, the oxygenated blood, and push it out to the rest of the body to keep ourselves alive. This muscle pump also needs blood supply to itself to continue function, and there are 3 arteries which supply blood to this muscular pump. When one of these 3 arteries gets blocked by deposition of a cholesterol deposit as a result of the risk factors we're talking about, then we start getting the symptom of what we call angina, which is discomfort in the chest, like a pressure when you walk. And if we stop walking, it slows down. But if this partially closed pipe, think of it as a water supply to our house, with a pipe is partially closed, and if it blocks off suddenly with anything which gets stuck on it, the water supply stops to our house. The same thing happens to the blood flow to the heart. Suddenly, a clot gets stuck as a result of many predisposing factors, and that clot suddenly stops blood to the heart, and immediately there's a lack of blood circulation to the heart itself, and the heart muscle starts dying. This is represented by severe sudden onset of chest compression. It is a very heavy pressure on the chest, going down to the arm, usually associated with sweating, ghabrahat, nausea, vomiting, in such a manner that most people feel that this is like nothing, it's like a compression or squeezing or a load on the chest, and they've never experienced this before. It's like a sense of doom. That is the typical feature which presents as a heart attack. Occasionally, people may get the pain down the right arm, may actually get just sweating. Diabetics especially get atypical presentations, which may be just ghabrahat, vomiting, breathlessness, but not severe chest pain. These symptoms, if they've never happened, and some may just get indigestion even, it's like an acidity, and many patients which we see say that I was having acidity throughout the night. I thought it was some of the chanas that I had taken, cholas that I had eaten earlier, and I kept taking antacids. And then it didn't get better. After a few hours, then I go to the hospital, and then an ECG is done, and it was a heart attack. So they mistake it. So it's very important that if it's unusual indigestion, which is not getting relieved by simple antacids within half an hour, one should be sensible enough to get an ECG done. When you experience such a situation, the most important thing is to keep it in mind. Aspirin tablet is one of the most effective treatments of a heart attack. And it's fine that in such a situation where you actually experience sudden severe chest pain, which can be a heart attack, especially going down, and especially if you have risk factors of diabetes, hypertension, family history, or raised cholesterol, or have known to have some blockages or the other, aspirin, followed by immediately going to the hospital. Time is muscle here. We say get to the nearest good hospital next to you. And it's very important to do that, because diagnosis, just like you said, has to be established, because then only immediate treatment gets started. We talk about time is muscle. The reason we say that is that every minute which passes by kills off and damages more of the heart muscle. And this heart muscle keeps dying minute by minute, hour by hour, up to 12 hours. The earlier we save it from death, the heart muscle, the more we actually save the muscle function, we preserve the heart function. And that is one simple indicator which actually says how long you will live. So if we damage the heart muscle, our survival goes down, our risk of living long life goes down, complications come up, we actually have a lot of problems. So we actually need to get to the hospital very fast. And then you ask me, what will happen when we get to the hospital? What is the first test that I would actually have? The first test is an ECG, a simple test. That will establish straight away whether the severe chest pain is a heart attack or not. Everything else is superfluous. One single test is needed as an ECG to establish whether it's a heart attack or not.